Welcome back to KeithTalks. So I was thinking today we could talk about my wife's pregnancy and our experience with that and our experience with the hospital. So basically, my wife and I found out that we were going to be having a baby January of 2024 on our younger dog's birthday. She just said that she just had a feeling that day. She wasn't feeling like sick or anything. She just had a feeling that we should take a pregnancy test. So that's what we did. I stopped because I think I was working at the restaurant still. Yep. I stopped and I picked up some tests, and it was like the middle of the night. Not literally, but probably like 11 or 12. And then I brought them home to her, and she took one, and I was looking at a book because I was like, there's no chance that she's actually pregnant. Like, there's not a shot in the world. And then she goes, "It's positive." And I'm like, "Yeah, right. You're bullshitting." And then she was like, and I was like, what's wrong? She's like, it's positive. And I was like, "Oh, that's awesome. What do you mean?" And so that's how we found out. It was, obviously a shock a little bit, but very exciting. We obviously wanted a baby together since we met, really. And it was absolutely a great night. It made my week that we found out we were having a baby. So I don't think anything super crazy happened for a while. Basically, she made the first appointments or whatever. We didn't really have to do anything anytime soon. I think we had to wait like a month almost before we went in for the first appointment. And then they just did like a regular old checkup. They said everything was looking good so far. And then they said that not at the next appointment, which would be a month from then, they said at the next appointment following that, so 2 months later, we could do a blood test to find out about the gender of the baby. So now we're sitting here anxiously waiting, and that's what we did. 2 months later, we took a blood test, and then I believe it was like 4 or 5 days later, the results came in, and it was like 6 a.m, and she woke up, and she was like, babe, you gotta get up. And I was like, all right, what's up? What are we doing? And then she was like, the results are in. And I was like, all right, well, I guess I'm up for the day then. What are we doing? Where are we? What color clothes are we going to start buying? And so she opened it and couldn't read what it said because she didn't know what she was looking at. And then I looked and I pointed at it and I was like, look, that's the symbol for a female. And then sure enough, underneath it said girl. And we were having a baby girl. And that was another amazing day. She wanted a girl for sure. And honestly, I've always seen myself more as a girl dad than a boy dad, but I'll be happy with whatever. I love my baby girl, but if she was a boy, I'd love him just the same, I should say. But yeah, so everything was good. She was healthy. And then came I'm sure that at that point she was already feeling some morning sickness. I don't remember exactly how it played out, but now just a warning that this part is going to get a little vulgar, not like disgusting, but if you don't like vomit, I'm going to be talking about vomit, so so the first time that she really got sick when she was pregnant. She was really sick. Like we were really worried that something bad was happening, because it was almost a week and she couldn't eat, she couldn't drink, she couldn't do anything. And so finally, I don't think it was a week before we went to the hospital, but we sat at the hospital for, I think, 5 or 6 hours, and they knew that she was pregnant, and they didn't do anything. They didn't give her an IV to the lady who had barely drank anything in 3 or 4 days. They didn't do anything really. So they basically said, it's just pregnancy, you'll get over it. And then they sent us on our way. And then, probably 2 days later, we had to go back because it got worse and she couldn't drink at all anymore. And then finally they gave her an IV, and they gave her anti-nausea medicine, which I don't remember that she was super nauseous, but I know for a fact that she could not hold anything down, which anti-nausea medicine makes sense, I guess, for that. That's fair. And honestly, I'm just glad that they got her an IV, because she started feeling better almost immediately. I'm pretty sure she slept that whole day almost, because she was just exhausted. And in the IV, I think they had to put Benadryl or something that was drowsy, or that made you drowsy. So she was out of it for the rest of the day, and that's fine. Then the next day, she was pretty much all better, I'm pretty sure. And then the next time that she got sick was I made her eggs, because she was obsessed with eggs for a while, scrambled eggs, and I would make home fries too. And then she was eating these scrambled eggs, and then she had an urge, and then had to throw up in the kitchen sink. And there the eggs sat that I had to clean out of the kitchen sink for her. And that was not the worst one. Don't worry, there's more. Then there was a time where, I think this was next, she couldn't, I don't remember exactly how it made it there. You know what? I think I'm splitting up this next story. I don't know if anybody's ever heard of these things. They're called acai bowls. It's basically frozen fruit puree, but it's I don't know. It's kind of weird. But she hated Chinese food at that point. So I told her one day, hey, if you want to get an acai bowl, you can do that, and then I will get Chinese, if that's cool with you. And obviously she was fine with that. So that's what we did. She got an acai bowl. It was I think acai is a fruit, but it was pinky purpley with, a bunch of, blueberries and granola and shit on top of it. And so basically, she ate it, and then less than 5 minutes later, she puked all of it up onto the floor, because she couldn't make it to the bathroom in time, which is totally okay. I don't have a problem with that. I don't even have a problem with cleaning it up for her, because I know that she's not feeling good and she's having my baby, and it's the least I can do is clean up her puke for her. But basically, I go to pick it up, I grab a bunch of paper towels, and it is still freezing cold. And that is what stuck with me. The feeling of freezing cold vomit all over my... Oh God, that was the worst. And then I think that she wasn't feeling good, and she went out and sat on sat on the ground next to the couch and said that she had to throw up again, but she didn't, I don't think. But yeah, that I had a couple of acai bowls with her, and I will never eat another one because of that experience that we had with the vomit. That was rough. So the rest of her pregnancy was pretty good, I would say. She, her second trimester, I think, was definitely the best. The first, she had a lot of morning sickness, like I'm saying. And then the third one, she was exhausted. Like she could barely get out of bed some days just because she was so tired all the time, which is totally fair. And I understand. I don't understand the feeling of being pregnant, but I understand that she's growing a human being, and I'm sure that that's exhausting to do. But yeah, other than that, I would say it was a pretty good pregnancy for her. Like, nothing super out of the ordinary happened. She stayed pretty healthy. She had been working at a daycare at the beginning of her pregnancy, and she basically came home every other day with a new sickness. Like, she would come home with a cold one day, and then strep throat the next day, and then it was never ending. So luckily, I got a better job at like a government funded company, and she got to stay home for the rest of her pregnancy, and to this day she's staying home to take care of our baby girl, luckily. But so cut to her, I think it was her due date appointment, and basically there weren't any signs of like her going into labor. I think it was actually the day before it was her due date. It was on her due date. We had an appointment. And so they basically said to us, her doctor, if you want to go, you can go in tomorrow and get induced. And so that's what we did. We went and got induced so there's 2 hospitals near us. There's a major hospital in the central city, and they also have like a women and children division where I would say 90% of the children around here are born, because they're notoriously good. But they were doing renovations, and we heard stories about people giving birth in the triage unit because they didn't have enough room to have people give birth in rooms. So we went to the smaller place, which my mom was born there, my aunt was born there, I'm pretty sure my grandmother was born there. It's not that it's a bad hospital, it's just a little out of date, and it's small. And honestly, every hospital gets bad reviews. A lot, I would say. Like if you go on Google and you look at the reviews for a hospital, I would guarantee you that out of the first 5, at least 2 of them will be bad. So we ended up going to this smaller hospital, and we started with getting induced. Obviously, my wife got induced. I think it happened at like maybe 8 a.m. They told us to be there at 7, and then obviously they had to prep everything and blah, blah, blah. And so basically, 8 a.m. rolls around, they induce her, and then we're pretty much just waiting that whole day until, I don't know, like 2 or 3. They check how far she's dilated, and I think it was like 5 or 6. No, it might have been more than that. She might have been. No, I lied. I think she was 3 centimeters dilated at that point. And then they were like, all right, well, we can finish dilating you, or I don't remember exactly what they said that it was called, but basically they put her in labor at that point. So from like 3 o'clock onwards, 3 o'clock in the afternoon onwards, she was in labor. And so, yeah, she was in labor from 3 o'clock to 5 a.m. the next morning, and it was miserable, I would say, just judging by my wife. And she's a very, very strong woman. I couldn't go through half the pain that she can sit through. Like, I'll stub my toe and she'll be like, that didn't hurt, what are you talking about? And I'm sitting there like I need to amputate my toe pretty much. But basically she was fine with getting like medicine. So what do they call it? An epidural. So that's what she got. She got an epidural. But the guy who gave it to her, he was nice. And then the guy, because a couple hours later it wore off already, the guy who came and like re-upped it for her, he basically came in the room all hot and bothered, and he was like, you need to sit up, you can't do it like this, because she was laying down on her back. And so okay, fine, whatever. So we helped her get up. She was in so much pain that she couldn't sit up by herself anymore. So it took me and the guy who was doing the re-up of the epidural. It took both of us picking her up to get her up and in position. And then he was like, you need to straighten your back. You need to. And she was sobbing at this point because she was in so much pain, and he was pretty much yelling at her. And she was like, I can't. And so he started yelling more and getting more upset. And he was like, you need to straighten your back. You can't do it like this. So as she's sobbing, she's trying her best to hold her back up straight. And then finally he's like, all right, stay there. And she's still sobbing, of course. And then he does it. And he's like, oh, God, all you women are the same. You act like it's so tough. And in my head, I'm thinking, what the hell do you know? You've never given birth to a baby, have you? This is like a 45-year-old dude that we're talking about here. Like, you've never given birth. I'm sure, judging by your demeanor, you've never even had a wife who had a baby for you, or anyone close to you that had a baby. Basically, he was just being a dick about it. And then finally he left. She's still crying, the poor thing. And then after a while, it started to kick in. And then probably 3 more hours later, she was sobbing again because it hurt and the epidural had worn off. And she was like, I need another epidural. I need it. And they were like, we can't give it to you. And then it took her screaming and crying to get an epidural again. Like, it took a ridiculous amount of time, I would say. But, all right, fine, whatever. They want to make sure that she's safe and, she's not going to overdose or whatever. But, then it was early in the morning, I would say, like getting to 5 a.m. And she had been up for even longer than I had. Because she couldn't sleep the night before she got induced. She was so anxious about it. And then I had been up for almost 24 hours at that point with her. And so basically, the doctor came in, like the actual doctor, not just like nurses, and because they were all trying to coach her through it. They were having her in different positions and trying to, see if anything would happen. And then basically, the doctor came in and she saw because they had like an oxygen hookup to the baby on her head, and they were like, all right, I heard her say to one of the nurses, like, oh, we're going to need to prep for a C-section. Because every time she would push, the baby's oxygen would drop, meaning that the umbilical cord was wrapped around the baby's neck. So obviously we don't want to push the baby out while that's happening, because she could suffocate or just die. And basically, I don't think my wife heard that, because she asked what was happening, and then they still didn't tell her anything. And I was like, you didn't hear them? And then they go, we're prepping for a C-section. And then she starts sobbing, because that's her worst fear, is the C-section. She's heard horror stories about it. My mom had 3, and she was fine. I think her mom had 2, and she was fine. So basically, she's freaking out now. And then, lo and behold, I got dressed, because obviously it's a surgery, so they need you like scrubbed in or whatever. And then basically, as they're wheeling us to the operating room, they say, you have to stay out here, you can't go in with her yet. So now I'm standing out in a hallway as she's screaming and crying. I could hear her where there's like 2 or 3 locked doors in between us, so I couldn't get to her even if I tried. So basically, I could hear her screaming and crying and saying like, get off of me, and you're hurting me, and like literally screaming in pain. And so I was just standing there idly by waiting, because I couldn't do anything. I was freaking out. And then I come to find out, when I started talking to my wife later on, they had thrown her onto the operating table, not like moved her gently. They literally picked her up and dropped her. And then they ripped her catheter out in the process of doing that. So then she's, she just had a metal tube yoinked out of her, and they're not being nice. They're not letting her know anything about what's happening. And then finally, I'm allowed to come in probably like 10 minutes later, and she's cut wide open, literally from side to side. You can see her entire guts, like everything is just out, which I'm luckily I'm not super squeamish when it comes to that stuff, but it was still a little bit disturbing. And she was already out cold, pretty much, my wife. And I was like, babe, are you okay? And she was like, yeah, it hurts though. I was like, all right, that's okay, I'm here. And then I asked because there was a guy giving her like medicine through an IV, and I was like, is she okay? Like, what's happening? And he was like, we had to give her some medicine to calm her down, because she was trying to jump off the table, which is ridiculous. I don't think that she would try and jump off the operating table for, how her daughter is going to be born. But so, okay, whatever. They pretty much sedated her, and come to find out later on, they wouldn't tell her what they were giving her. She kept asking, like, hey, what is it? What are you giving me? What medicine are you giving me? And they wouldn't tell her what it was. So then she eventually is out cold, like literally dead to the world, my wife. And then finally they pull the baby out, and she's like blue or purple, and I start sobbing because here I am thinking my wife is out cold, my baby looks sick and like deprived of oxygen or something. She's literally like, I don't know if you've seen the guy who drank like iron or whatever. He, like that color, that's what my baby looked like. And my wife was out of it for that whole thing, and it was terrible. And of course I had to try and keep my composure a little bit, but you know, it's hard to do when you don't know how your baby's doing. And they wouldn't let me go into the room where they took her after until probably like 10 minutes later. And then I finally held her, and she's perfect. She's been perfect since. And honestly, I thought she was cute then, but she's a million times cuter now. It's crazy. But yeah, that's how my baby girl was born at 5:45 in the morning. And then don't worry, it doesn't stop there. So the hospital was obviously not great during the birthing procedure. And then once she was finally born, since my wife was still out because they sedated her without her knowing, I had to do the skin to skin, and I had to feed her a bottle first of formula rather than, you know, my wife would be the one doing that, which I don't mind, but obviously she got to miss out on that. And then she missed out on like the first few hours that my baby was alive because she was out still, which was obviously upsetting. And then yeah, so from there, the nurses were not great. A lot of them were, you know, very rude, or they didn't seem to care that much. And then the first night, I think it was the first night, there was one woman who was the nurse, and she came in at like, I think she was late that day. Their shifts were like 11 to 7 overnight. And then, so she came in at like 1, I think, and she woke my wife and the baby up at 1 to check her like temperature and her vitals and stuff, which I get that you have to do that, but when everybody's out cold, I wouldn't make that the first priority. She was having a rough night because, you know, it was her first night out of the womb, and she was a little bit upset before that, but then she came in and woke her up, and then she was up for 2 or 3 hours after that because of it. So we still didn't sleep that good that night. We probably slept like 3 hours altogether. So now we're running on 3 hours over the course of well over 48 hours, and my wife is running on less sleep, or 3 hours over the course of 72 hours, or something crazy like that. And so yeah, so they just weren't very understanding, or, you know, very like nurturing about it. Like they kind of just were like, we need to do this and we don't care what you think, or, you know. And I get that they have to do that, but they can at least try and give us our time, you know. Or like, I don't know, they just were like very down our throats about it, but they also didn't seem like they cared personally. They just were like trying to do their job, and then that's it. And yeah, so then there was one day where, because my wife is anemic now, I think she was at the end of her pregnancy too, but especially after, because of the C-section, she lost a lot of blood and blah 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 blah. So basically, she had to they gave her two options. They said you can get an iron transfusion, or you can take like 3 iron pills every day for 6 months or something crazy like that. So she was like, all right, well, we'll do the transfusion then. So they go and do it, and it's something where you put it in like your spine almost. And so they did it, and she was fine for about a minute or two, and then she had started having like muscle spasms and severe pain, and yeah, they didn't tell her anything about that, or the possibility of that. So then now she has to do the iron pills, but I guess they weren't even telling the truth about it, because once we got the iron pills, it said once a day, and it was for like 90 days or something. And she's going this week for a blood test to see if she's still anemic or not, but hopefully the iron helped. Otherwise she's gonna have to probably do it again. And yeah, so then by the end of it, we were there we got there on a Tuesday to be induced, and then obviously Wednesday she was born at 5:45 in the morning, and then we were there all day Wednesday, all day Thursday, all day Friday, which they said that was pretty normal. But if we really wanted to leave, we could. And we were like, all right, well, I guess if we have the option, we might as well stay and see, like, just to make sure that everything's okay. Because she had a lot of bleeding still, and, she was still in a lot of pain. So then we were there 3 full days, and then Saturday came around, and they wanted us to stay longer. And we were like, all right, no, we're going to go now. Thank you. Like, we're going to leave. We've been here more than long enough. And yeah, so that's it. If you have the option between a big hospital that normally does births and women and infants and all that, you should pick that one over the small hospital, even if you think that there's a possibility of something going wrong. Something's going to go wrong no matter where you go. You may as well be with the people who do this every day. At least that's how I feel. If we have another baby, we're definitely going to go to the bigger hospital rather than the smaller one again. But again, that's just our experience, and we still ended up with the cutest baby girl in the world, and we're still very lucky that everything was okay, realistically. Like, it could have been worse. It just wasn't the most pleasant experience, and they were not the most pleasant people to deal with. But like I said, we got lucky. We still have our baby girl, and she's still healthy and happy, and yeah, everything's pretty good. So thank you guys so much for watching or listening, or however you're consuming this. As always, I love you, and I appreciate you, and you are beautiful. And yeah, I hope you have a great day or great night, and thanks again.